مرحبا دكتورة، يعطيك العافية. معك طالبك رشيد سلمان رشيد. راح أبلش دكتورة بالكيس برزنتيشن. We have a 6-year-old female who was referred to a pediatric dentist for evaluation of a recently noticed left cheek swelling. She was subsequently referred to an oral surgeon for the evaluation of a large vestibular swelling and cyst-like lesion involving the left maxilla, asymptomatic and is somewhat firm to palpation and was not fluctuant. The swelling was not painful and there was no neural dysfunction. We have part of investigation. The first one, we have the radiographic investigation. The CBCT revealed a large radiolucent lesion at the left posterior maxilla, filling the left maxillary sinus. The lesion is pushing teeth apart and has focally extending into the lateral nasal wall. The swelling is not well demarcated, ill-defined. We have panoramic view of the CBCT image. Large and diffuse radiolucency of the left posterior maxilla pushing teeth apart. We have axial view of the CBCT image taken at first clinical presentation, demonstrating a large neoplasm expanding buccally and filling the left maxillary sinus. We have also the coronal view of the CBCT image, demonstrate a large neoplasm filling the left maxillary sinus and breaking through the bone in more than one area. We have the second CBCT image, demonstrate a large neoplasm displacing teeth and filling the left maxillary sinus. Okay. The second part of the investigation was the histological examination. We took an incisional biopsy and that reveals multiple pieces of soft tissue composed of loose and myxoid connective tissue. It's made up of stellate and small spindle-shaped fibroblasts suspended on delicate collagen fibers. In some areas, the myxoid connective tissue is hypocellular, while in others it's slightly more cellular. And has thicker collagen fibers. There is no evidence of an epithelial component or tumor-produced calcified material. There is evidence of host bone surrounded by the myxoid connective tissue. The immunohistochemistry strain is negative with S100, which rules out myxoid peripheral nerve neoplasm. We have the histological picture here. Our differential diagnosis. In the first place, we have the fibrous dysplasia. Second place, we have central odontogenic fibroma. In the third place, we have central giant cell granuloma. Lastly, we have our diagnosis, odontogenic myxoma. Sorry, Doctor. The diagnosis was odontogenic myxoma. The large swelling of the maxilla filling the maxillary sinus and displacing teeth is consistent with the behavior of odontogenic neoplasm that are benign but otherwise locally aggressive, such as that of odontogenic myxoma. The site is not unusual for the odontogenic myxoma, since it occurs almost equally in the maxilla and mandible, with a small predilection for the posterior mandible. The age, however, is highly unusual, since odontogenic myxoma, which rarely occurs under 10 years of age. The histology is that of odontogenic myxoma. Thank you دكتورة، وأتمنى تكوني بخير وصحة وسلامة أنت والأسرة الكريمة، والله يعدي هاي الأزمة علينا وعلى الأمة العربية أجمع.